Thank you. Good afternoon, everyone. Thank you so much for joining us again this week for another Healthy Brain Virginia Partner Update. We're excited to share another one of our mini grant recipients today, as well as provide an update of the annual partner survey that many of you completed. So as always, we'll start with some housekeeping. Again, the session is being recorded. So if you want to share it with others afterwards, we'll be sure to share the link with you so that you can disseminate it. We also ask that you remain muted unless you are speaking or asking a question. We will have the allowance for some questions and answers throughout the presentation today, and then also time at the end as time allows for additional questions. We do encourage you to use your camera as well. It's always nice to see your shining faces while we're talking, so it's nice to have that visual of an audience. And then we also encourage you to use the interactive features as you see fit. So chat reactions and raising your hand if you do have a question. And then we also ask if you could avoid any background discussions. Again, going back to if you have to take a call or step away, please put your computer on mute. Thank you so much. And so we do have the agenda for us today. We'll start off again with some introductions. We'll go over our partner survey as well as our featured speakers from Insight Memory Care Center with us today to provide an update on their project and the great work that they've been doing. We'll also talk about some partnership opportunities and then end with some announcements before we adjourn today. So again, I want to reintroduce our Healthy Brain Virginia team. We have myself, Millicent Miller. I serve as the Health Equity Consultant with the Virginia Department of Health and also serve as the Principal Investigator for the Healthy Brain Virginia Project. And we also have my colleague, Rachel. Rachel, do you want to say hello?
Hello, good afternoon, everyone. My name is Rachel Coney, and I am the Brain Health Coordinator with the Virginia Department of Health. Thank you very much for being here today.
Thank you, Rachel. And so we will, as always, we want an opportunity to get to know who's on the call. So if you would please drop in the chat your name, your organization, and the city or town that you are streaming in from today. And we'll also allow some time for some folks that are in the waiting room to join us.
Stephanie in Richmond, Elisa from Norfolk, Evelyn in Baymount, Senior Connections Richmond. We have Fairfax and Henrico.
Wonderful. Thank you, everyone. And of course, Rachel and I are in Richmond as well. And keep those responses coming. Then another introduction question for you is, what is the most interesting place you've ever visited? I think we got some great responses last time. I'm interested to see some additional responses today. Rachel, do we have anything in the
We've
chat?
got Stephanie. Where's this one? I'm not even sure how to pronounce that one. Romania, Zimbabwe, Turkey. Mozambique.
Oh, wow. Some very interesting places.
Very.
Wonderful. Thank you so much for your responses.
Zimbabwe. Great places.
So last time we met, we talked about a few, we provided an overview of the Healthy Brain Virginia program and just a reminder of our focus on addressing changing systems in the environment and policies to promote risk reduction, to improve early diagnosis and prevent the management of comorbidities. And we're doing that through a public health approach to Alzheimer's disease using data to drive our actions, to also develop public health actions, address the social determinants of health, or those factors within the environment and the communities that we live that have an impact on our health, and then also providing support for caregivers and people that are living with dementia. So I'm going to pause my screen for just one moment while I make sure that we have all of our presenter slides up as well. There we go. Sorry for the interruption, everyone. And so, additionally, as we talked last week, we have several strategies that we are looking to address through our current funding. And we'll talk more in just a few moments about some exciting news as we're endeavoring to secure additional funding for the program and how you can be a part of that. But as a part of today's discussion and sharing, we want to focus specifically on the use of data and how we're using that to inform our decisions and ensure that we're using that public health approach to be able to address those disparities that we're seeing in our communities as it relates to Alzheimer's disease and related dementia or ADRD, the comorbidities, and ultimately looking to improve the health and well-being of those that may be at risk or living with dementia, as well as providing support for those who either care for from the sense of a caregiver, but also providing professional services and care to those that are impacted within our communities as well. And so through the partner survey, we had an opportunity to solicit some recommendations from our partners and just understand better the landscape surrounding ADRD. And so the purpose of the partner survey was to better understand what current efforts our partners and our stakeholders were engaged in as it relates to ADRD. We also wanted to identify needs, gaps, barriers, and challenges to providing programs and delivering services, as well as using those to guide our future statewide strategies that can be used to better address the needs of Virginians that are living with or at risk for developing ADRD, caregivers, partners, and service providers. We were targeting those that are providing services to older adults throughout the Commonwealth, and we had the survey open for about 6 weeks to be able to garner enough feedback to really drive our decisions and have a representative sample of those that are actively engaged in this space. We did also take the approach of identifying an existing tool that could help us in this process. And so we've used an adapted tool that was developed by the state of Texas, in which they use this to also identify needs, gaps, barriers, and challenges and facilitators to those that they were working with their stakeholder groups. And so with that, I'm going to turn it over to Stephanie Curry, who will share the results of our partner survey. And then after that, we want to have a discussion about how we can get better engaged and just work better in terms of our partnership as we're all looking to address those issues that are related to our aging adults within the Commonwealth. And so, Stephanie, I'll turn it over to you and I can start and drive your slides. Let me know when you want me to advance.
Okay, thanks. Hi, everybody. I'm Stephanie. I'm an epidemiologist and evaluator here at VDH. Like Melissa said, I'm just going to go over the results quickly with you guys. So overall, there were 75 people who participated in the annual partnership survey, and most who completed it worked for a local health department, followed by VDH, nonprofit organizations, and universities or medical schools equally. More than half of you all were not licensed healthcare providers. However, of the ones that were licensed, most were either mental health workers or nurses that practiced in a hospital. Next slide. And then most who filled out the survey were caregivers to a person with Alzheimer's or related dementia, either professionally, such as a healthcare worker, or non-professionally, such as to a friend or a family member. Of the people that were caregivers, most had worked in the aging and older adult field for about 1 to 5 years. Next slide. And then in reference to the Virginia Dementia Roadmap, most of the respondents' work was related to coordinated systems of care and support and education and awareness. Next slide. Most of the projects respondents are working on were going to be delivered in regions 2 and 3, so the northern and southwest regions. And additionally, most work was being done in rural regions instead of urban or suburban. Next slide. All but one respondent served at least one of the underserved, underrepresented, or under-resourced communities listed in the survey. And most of the respondents face similar barriers across the board when serving these communities, such as language and cultural barriers, lack of patient or provider trust, lack of crisis services such as housing, and then just lack of general resources like transportation funds and so on. Next slide. Based on the barriers just mentioned, the respondents said that crisis and translation services, ADRD educational supplies, medical equipment, and more training would be helpful to eliminate said barriers. Next slide. And then lastly, most of the respondents were interested in being a part of a statewide partnership with VDH and other stakeholders, and most were interested in doing this in order to share and learn best practices, acquire additional information from subject matter experts, and to network with peers. So that's just a quick synopsis from the survey, and that's it from me, Millicent. Thank you, everybody.
Thank you. Thank you for that overview of the survey. And so I wanted to, before we talk about partnership opportunities, I will just kind of go back to some of the things that Stephanie mentioned. In terms of the survey, based on the purpose, of course, we're wanting to identify those opportunities to support one another and to also identify synergies that we can really reinforce and capitalize on all the great work that we're doing across the Commonwealth. And so in looking at some of these things that came up out of the survey in terms of needs, I think that we all can agree that we're continuing to see many of the same challenges in some of our underserved, underrepresented, and under-resourced communities as it relates to what we're sort of framing as the social determinants of health, SDOH, and political determinants of health as well. There's many terms that are used to address many of these challenges that individuals are faced within the communities, such as, housing, food access, as we're thinking about the diversity within our populations, having adequate translation services and meeting the general needs through financial, transportation, and other resources, as well as the need to continue to provide education, either through very formal situations such as educational classes or having educational materials to be able to pass out for those who may be experiencing cognitive decline or have questions about their loved ones as they're providing care for them. And additionally, thinking about, how can we continue to work together to address these needs. So that brings up a next opportunity as I continue to flip through the slides that Stephanie shared with us, opportunities for continued partnership. And so as mentioned during our last time together, we are currently in the third year of a 3-year cooperative agreement with the Centers for Disease Control and Prevention, or CDC. And so as we're wrapping up this final year, we are preparing for another round of funding. We're excited for the opportunity in that it gives us more time, moving from 3 to 5 years, to continue the great work that we've done with our partners, to continue to address those barriers that we're seeing as it relates to ADRD throughout the state. And so in particular, when it comes to our partners, we are seeking opportunities for engagement across some of the strategies that are tied to the new funding opportunity. And those are shown here on your screen. And so they are related to educating members of the general public. And this in particular really focuses on populations of high burden and educating them about ADRD topics that are related to primary, secondary, and tertiary prevention. So, with respect to these opportunities, it's about thinking about dementia risk reduction from the primary sense, early detection and diagnosis, linkages to treatment, care, and services from a secondary prevention lens, and then also thinking about prevention and management of comorbidities like hypertension, diabetes, high cholesterol, arthritis, and other chronic diseases that an individual may be challenged with as they age, and ensuring that we are providing adequate management, prevention of those comorbidities that could lead to better outcomes in terms of health, as well as prevent hospitalizations, and then also support for caregivers that are taking care of those that are living with dementia. Additionally, we want to educate providers and other professionals about ADRD topics. And as we'll hear today and in the future from some of our mini grant recipients, just how they've been able to do that. So we want to continue to be able to do that as well. And then we also, something that's new for us in this new funding opportunity is we're looking to increase the number of community clinical linkages among healthcare systems and services, public health agencies, and community-based organizations to improve both the coordination and dementia outcomes. So this includes the number of people knowing how and where to seek care and support, establishing formal agreements between entities that could mean that they are cross-referring to various programs, be it a clinical, an FQHC, Federally Qualified Health Center, or Community Health Center, referring to an area agency on aging or a public health department to provide those additional supports and services. And then in addition to that, connecting healthcare systems and providers to community-based organizations and services to ensure that we're doing that adequate referral. And when we mean bidirectional referral, that means providing information to both entities or multiple entities and having that follow-up once the referral is made. And so before we get to our next speaker, I just wanted again to share these opportunities with you, and then also want to provide an opportunity if you have the capacity and are interested in working with us in the next cooperative agreement, which will begin in October of this year. We would love to have a conversation about what that partnership could look like and how we can support you in expanding your efforts, specifically around the education of providers and professionals, educating members of the general public, including caregivers, and then also looking at that bidirectional clinical community linkage to ensure that we're improving care coordination and ultimately impacting in a positive way our dementia outcomes. So with that, I wanted just to see if anyone wanted to share if they're interested and let us know so that both Rachel and I can get in contact with you to talk more about this opportunity.
I believe the Alzheimer's Association has already said yes.
Yes.
Okay, I just wanted to make
Yes.
sure.
Yes, and I would show our list of partners. We have many great partners that have already signed on, and I just want to give an opportunity for partners who we may not have worked with in this new opportunity. And so, yes, absolutely. Alzheimer's is signed on, Department for Aging and Rehabilitative Services. We're also looking to continue to partner with our mini grant recipients. Insight Memory Care is one of those in their feature today, along with VCU and VPAS and Beard Center at University of Lynchburg. So we do have several partners that we're looking to enlist, but always looking to expand our partnership base. And so if you want to noodle on it a little bit more and get back with us, I will definitely share Rachel's contact information at the end of today's presentation so that we can connect with you quickly to identify opportunities for a partnership. But thank you so much. So before we transition, I wanted to see if there were any questions for Stephanie related to the survey results or any additional questions about partnership opportunities. And feel free to use the chat. I'm seeing some come in, so thank you so much. So Amy, yes, we already have you on board. And Senior Connections, awesome. Actually, you came up in a conversation we had yesterday, Evelyn, so we'll definitely be reaching out. Okay. So with that, I will turn it over to our guest speakers. We have both Amy and Melissa joining us from Insight Memory Care Center. And I can advance the slides for you, so if you just want to let me know when to advance.
Great, thank you very much, Melissa. My name is Amy Sternwise. I am the development coordinator here at Insight Memory Care Center. And so I'm going to let Melissa introduce herself when she gets started, but I'm just here to tell you a little bit about who we are before she tells you about the great work we're doing. And so I just wanted to share with you that Insight Memory Care Center provides quality memory and cognitive care for families living with dementia in our community. We're a nonprofit organization that's been serving Northern Virginia since 1984. And we offer a spectrum of holistic care. So with our goal is the vision of a community where those affected by cognitive impairment can achieve the highest quality of life. Our founder began the Adult Day Respite Program in a church basement after she was leading a caregiving support group and recognized there weren't a whole lot of resources for caregivers to have time away from their caregiving duties. And this continues to be our focus even 40 years later. The majority of the work we do is focused around that. How do we do this? We offer specialized health and wellness programs for individuals living with memory and cognitive impairments. And we support their care partners and families and the education and engagement opportunities for the wider community as a whole. I'm sorry, I'm on the next slide. I'm terrible about this. I don't present, I write grants. So this is our mission, and our vision is basically what I was talking to. So if we can go to the next slide. So our day programs care for individuals in all stages of dementia, and that's one of the things that sets us apart. For those with mild cognitive impairment or MCI, Insight's early stage programs promote brain health and building cognitive reserve while creating connections with peers in a supportive environment. Our first early stage center opened in Sterling, Virginia last year, which expands our physical footprint in Northern Virginia for the first time in our company's history. Our signature program, the Adult Day Health Center that's located here in Fairfax, which is our largest facility, provides a safe, engaging, and therapeutic environment for individuals with mild to late stage memory impairment. And we are the only dementia-specific day center in the DC metro area, and still the only adult day health center in Northern Virginia that have programs for people in the later stages of dementia. And this is part of our licensed facility. So there's we have up to 60 people can be in these programs. As families are also impacted, a big part of what we do is offering support groups, support programs specifically for the care partners to help them reduce stress, plan for the future, and build a network of support that provides practical solutions to caregiving challenges. Our innovative education programs and virtual resources help family members remain confident and effective in those roles. And it has the added benefit of increasing awareness and understanding of the disease in the community, which is part of what we do as well. And we offer programs in person, virtually, at partner organizations all over Northern Virginia, and with Melissa's recent efforts, even outside the region as well. She's been doing all kinds of interesting work. We can get the next slide. Oh, sorry, you were already on it. One more back. At Insight, we always talk about meeting the families where they are. We know that every story is unique, and together we hope that these families navigate the path no one wants to be on with the tools they need to be empowered in that caregiving. We're blessed by the people that we have the privilege to serve, tell us that our programs are making a difference in their lives and profound impact when they most need it. So I will let Melissa talk on the next slide with what we're actually doing in that community.
Hi, my name is Melissa Long. I'm the Director of Education and Support. And I've been working with older adults for about 20 years. And my background is that I'm a certified recreational therapist. So one of the first partnerships we have is with the Alzheimer's Foundation of America, and we do a couple things with them. We do scheduled memory screenings that I do every month at different locations, sometimes more than once a month. And we partner both with communities, doing it here on site as well. And we do that with the Wellness Center of Older Adults. I'm also out at the Lockwood Apartments out in Arlington, so I am getting around to different counties to do that. And also providing it to diverse populations. So the Lockwood apartments that I go to, we actually have a Vietnamese and Korean population I'm doing it with. So we're really trying to spread out who gets these services, because as we know, there's a lot of disparity in who gets care and support with dementia. The other piece we do with the Alzheimer's Foundation of America is we partnered with them and got a virtual reality program with Viva Vida. And so in our adult day center, we have 4, we're getting 2 more VR headsets, and we actually take them on trips to places. You know, we've been to different countries, we'll go out to the ocean, we'll go kayaking. And it not only does it bring mental stimulation, but it also can relax when there's agitation and behaviors. And we're going to be working on doing some research tied in with that as well to see the difference. But they really get a kick out of it. You can see some of the pictures there. They really get engaged in it and turning their heads and going towards different things because it's a 360 view. So that's what the Alzheimer's Foundation of America. And next slide. And then very excited with this program. We actually just did this last week. We partnered with AARP, and we will continue to partner with them throughout the year with a bunch of other events. We did a talk with the Alzheimer's Association with Dr. Hill on the disparities of dementia care and how we can learn to support change. He came in last week, and it was all about disparities in dementia care for African American, Hispanic, and the Native American population. And we ended up having 65 participants. And we also partnered, we did a blog, Dr. Hill and I, about this topic as well, that's on our website. And we're going to then partner with him with the Lorton Action Community Center, which is an impoverished community center here in Fairfax County, to bring more information and education to those populations related to dementia care. With ARP, we had 65 people involved, but we had 169 people register. And over 100 of them were new to our program that didn't know about Insight. So that really opened the doors for us to be able to get more information out there to the community. So I'm excited to pair with them for a lot of the other programs that we're going to do this year. You know, we're trying to reach out to different areas to do that. So next slide is just our information if anyone wants to reach out to us. All of our stuff on our website is linked. If you go to insightmcc.org/events, you can see all the amazing things that we're doing. We're constantly on our toes, running around doing presentations and so forth. So does anybody have any questions?
I'm not sure if we can see the chat, so if there are any questions, you can let us know, but otherwise.
Yes, Evelyn wants to know, are you doing light therapy?
Light therapy?
Yes.
We are not doing that. I have heard of it. We are starting to bring a bunch of new things in, but we haven't gotten to that one yet. So I will definitely add it to our list of things to look at, because we love doing new and innovative things.
Yeah, we've been fortunate here. The VR program is a grant funding that we received from AFA, and we're able to fund a dementia program and saw it in action in DC, and we're able to bring it to our center. It's a great program it's adapted for people with disabilities and things, so they have limited movement and that kind of thing, so they can still participate in that way. We also have the OB for seniors in our center as well, and we're looking to expand that program. It's an interactive gaming system, and I always have a hard time explaining this. It's like it projects on things, so like projects on a tabletop or a wall, and so there's no paddles or any of that kind of thing to play a game, and you pop bubbles and you chase fish, and it's great. It's a competitive kind of game, and they can be in as involved or as much or as little as they want, and it really is a lot of fun.
What's nice is you can adapt it to their different cognitive levels. So like popping bubbles, we would do with our end stage group. But we could do a card game or a complicated jigsaw puzzle with our earlier stage. And it collects all this data that we can print out to show the difference in how people are doing. So we're actually waiting to hear on partnering with George Mason through a grant to bring another system in so we have it in more than one room.
It feels like every time we have one of these programs, we get introduced to another community or another project or another partner that can help us expand in that way. So it's been great.
You're muted.
I am muted. Thank you. I also saw in the chat Evelyn put art, so I'm maybe assuming that she's mentioning art therapy. Are you doing
Yes.
art therapy?
Oh, absolutely. We have an artist on our recreation staff, and we do art therapy almost every day.
Yeah.
Art therapy is a big part of our program. Art therapy, music therapy, movement therapy. We had a musician in today. All kinds of stuff is always going on.
And we'll even bring individuals in from the outside. We actually had an artist come in last week and do a project with our participants, and they had a great time with that, just to change it up a little bit.
I even dragged my husband into it once. He's a scientist, and he came and did science experiments with them. So yeah, we have a lot of.
We froze a banana.
Froze a banana.
They got a kick out of that. So yeah.
Liquid nitrogen froze a banana in about 2 seconds flat. So yeah, it was exciting.
Wonderful. Do you have any other questions? So I do have some questions, and this specifically is related to the work that you've been doing as a mini grant recipient, and knowing that you've done several of your virtual or in-person educational classes. The brain health as you age, Dementia 101. And so you've been able to tap into a variety of different partners. Can you talk more about how you've been successful in connecting with partners to be able to offer these virtual or in-person programs?
Yeah. So we've started a couple. We really reach out to our community centers. They're all about us doing the basic talks to educate people. They love doing education. So that's kind of been an easy connection. One that has helped is we have a published book called Caregiving at a Glance. That's 5 chapters, an easier simplified of how to just be a caregiver. And that has really gone exponentially on Google, where people have found out about it, which has then linked us to other organizations. So for instance, with the Lord in Action community, I first got connected with George Washington's original church that he founded here in Alexandria, because they wanted to give all of their lays people a copy of that book and educate them so that they could interact with their congregation. And then they connected me with Lorton Action Center. So it's a lot of little things like that that come about that lead to those connections. I was searching for someone to do this disparities talk, and I got turned away from anyone and everyone you could think of. And finally somebody said, talk to Dr. Hill, and I got connected with him, and now he's ready to run with it and go other places with me. So it's just a lot of legwork underneath, I think, and them seeing the value of what we do for them to then want to connect with us even more and connect us with other people.
Yeah, it's always interesting the connections we make. It starts with things like AARP, and we look to them for marketing, and we kind of developed that partnership, and there's stuff that she's doing with the library community in our area, trying to expand that. So some of the logical ones, like the aging community with us or the senior centers, those are very logical ones. It's when we start tapping into things that are outside of that, where Melissa did a presentation with the USO last month, and that's an audience that we wouldn't have partnered with normally, but it was a great opportunity and has helped us get other connections that way.
Great, thank you so much. And as it relates maybe to reaching communities that have been underrepresented or underserved, can you talk more about, you mentioned the partnerships, but I know sometimes in even those partnerships, you are still not reaching those who need services the most. So can you talk more about how you've been able to tap into maybe some of those underserved and underrepresented communities?
So we're still in the process with that. And as you know, it's not one small thing that connects us with them. It's a bigger picture. And so, if I'm going to go out and present to these communities, to these organizations, our website needs to reflect that too. Do we have things in another language? Do we have translators? How are we providing support? Do we have support groups that are bilingual? And so it's a much bigger picture. And so we're working on all those pieces right now. We're utilizing resources from NIH, the Alzheimer's Association that are already translated for certain resources, but we obviously want to have our resources translated. So it's going to take time to do all that. And we're very aware of that. And so when we talk to like Lorton Action Community Center, they're going to provide a translator when I do the presentation there and see how that works, and fund that piece, because that, as we know, translators are very expensive, but we want to get the word out that way. We do have staff that speak different languages, but we want to make sure if we're offering these different things, that if someone's going to come to our adult day center, that we can communicate with them in some manner. So we're trying to get all those pieces together, and obviously that takes time. We're also trying to connect with the Asian American Chamber of Commerce to get connected with people who can help with that as well, there, and the Hispanic Chamber of Commerce. So we're trying to think a little bit outside the box with those things. They might not necessarily be a part of the dementia community, but how can they get connected? Because they do want to help.
Wonderful. Thank you so much. And I guess my next question is, what do you see as the next step, is building upon the work that you've done?
I think one of the big goals I came in with working here was just bringing diverse topics, whether that's for diverse populations or really highlighting some of the more rare dementias. We've really partnered really well with the Lewy Body Association and Frontal Temporal Lobe, and so we're providing some specialized events tied in with them. Today we actually have a support group for the Lewy Body Association, and they did a talk for us in January, but they're doing one for the support group today, and magically we went from like 15 support group people to 50 today, because they want to be a part of that. So we're trying to bring that piece in, because we all know about Alzheimer's. Everyone knows about Alzheimer's, but it's all the other ones that aren't, we're fortunate if a celebrity gets it, like Bruce Willis with FTD, and now that's getting more wind and people are hearing about it, but they still don't have all the support that they need. And so making sure that they have that, and us doing some unique topics. We have a driving school. It's going to do a talk on how to get assessed if you should still be driving once you have the diagnosis and where to go. And so bringing in those unique conversations. The other part is getting out to rural Virginia. I have been working with a couple of people. We've offered an online program. I just got a call from someone out in Orange County to come do a presentation for first responders. So they are reaching out to us in other areas because we want to make sure. I feel they almost get neglected the most because there isn't a lot of bandwidth out there. And so we want to make sure that we're reaching them as well, so that they don't feel like they're isolated, because as we know, isolation is the number one key to people declining more. So,
and I think that's what COVID gave us the skills to. Yeah. We know how to do a little more virtual work. We know where it can be effective and where it can't. And so that allows us these opportunities to be able to offer those kind of programs.
Thank you. We have a question from Missy. Missy, thank you for joining us today. How can we connect those with Lewy Body journey to your support group?
So if you haven't, go on our website on insightmcc.org, and you can go under events calendar, or under support groups. There's an option for that. You can see all the support groups there, and then they just sign up on there. That's too complicated for them. You can send them straight to my email, melissa.long@insightmcc.org, and I can help them get through that process. And I have people in that group from California. They're all over the place. It's not just local.
Oh, wonderful, wonderful. And I can pop your contact information back on the screen as well before we conclude, so that folks can jot your information down and get connected. You brought up a good point about how you've been able to, I guess one of the great things that have come out of COVID is the increased use of technology, right? To be able to virtually connect to those that aren't near us or can't convene for a variety of reasons. And so when we think about older adults, one of the barriers for older adults and just in general is navigating technology. How have you been able to do that effectively? Any tips you can share with those who are looking to enhance their virtual offering?
So I think one of the pieces, for the most part, they've all jumped on. we have a good generation right now that is learning from it. The people that have struggled, a lot of the local libraries do free technology classes. ARP also does them. And so if they're really struggling, I encourage them and I will connect them with someone in those two organizations that they can have a one-on-one to get through the technology, to help with that piece. And that seems to be really helpful for them. Sometimes I can guide it over the phone, but sometimes that's just too beyond them. But yeah, they normally do really well because, we send out a reminder email for our stuff and it has the link and they just click on the link and it immediately pops up where they need to go. So it's not, they're able to follow it from there. But if not, we'll do what we can or guide them to the right people for it.
Yeah, when we're building out those systems and stuff, one of the conversation we're always having is how is this streamlined? How is the easiest way for possible that works for us, but also works to streamline that process for our users.
Yeah.
Any additional questions for Amy or Melissa? We're not seeing any additional questions. So actually, I will go back for those who weren't able to make sure you jot down their contact information if you want to reach out to them. To the website, phone number, and Melissa or Amy, if you wouldn't mind maybe dropping your email in the chat if you haven't already, so that folks can get in contact with you directly via email. Thank you. So with that, we'll move on to just an announcement. We thank you for your time today, and thank you so much, Amy, Melissa, and Stephanie, for sharing more with us today. We're very grateful to have partners like Insight Memory Care Center that are continuing to do great work in the community and allowing the work of the Virginia Department of Health and our other partners to really reach those underserved and do a lot of the boots on the ground work that we're not able to do as a state entity. So we really appreciate our local partners and all of their efforts in reaching hundreds and thousands of people via their educational offerings, as well as just the information they're sharing via newsletters and other communication channels to really spread awareness around ADRD, including those that are not as popular. Most people don't know about under the large umbrella of dementia and bringing awareness and notice to those. In addition to just being able to continue the great work that you're doing with educating providers as well. So thank you so much for being with us today and looking forward to continuing our partnership. So with that, I want to cordially invite everyone to join us for our next webinar, which is the third and final webinar in our Healthy Brain Virginia Partner Update webinar series. Next week, we will feature another one of our mini grant recipients. We'll feature the University of Lynchburg's Beard Center on Aging, as well as the Valley Program for Aging Services. So we'll have both Denise Scruggs and Joyce Nussbaum join us to talk about the work that they're doing, specifically how they're implementing education and trainings for the community as well as providers. So we hope that if you haven't already registered, that you do register and join us for our next webinar next week. So with that, again, thank you so much for joining us. Thank you to our speakers today, and we look forward to seeing you at our next webinar on next Tuesday. Have a great day, everyone.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.